In today's video, we will be demonstrating the mixing and placement of a temporary sedative filling. The material we will be using is IRM, which stands for Intermediate Restorative Material. It is a zinc oxide eugenol temporary cement, and we will be using a powder to liquid hand mixing technique for a temporary restoration consistency. The armamentarium for mixing zinc oxide eugenol cement consists of zinc oxide powder, the powder scoop, eugenol, an eyedropper, a treated paper mixing pad, spatula, a placement instrument, 2x2 gauze squares, and 2x2 alcohol gauze for cleanup. As you can see, we have isolated tooth number 31 with cotton, and we are ready to begin. The ratio for mixing this IRM material is 1:1. You have to gauge how large your tooth prep is in order to decide how much material to mix. Today, we will be using 2 drops of liquid to 2 scoops of powder. We will begin by fluffing the powder and mixing the liquid to ensure proper consistency before mixing. You will notice that as soon as we use any of the liquid material or any of the powder material, we must close the containers right away to avoid excess moisture or evaporation. Either of these factors could affect how our material mixes and sets in the prep. Again, we are using 2 scoops of powder to 2 drops of liquid. Then we will slowly start to incorporate the powder into the liquid to form a homogeneous mixture. Using both sides of the spatula, mixing, stropping, and scraping the mixing pad until all the powder is utilized. It may not seem like you will need all of the powder while mixing, but you will certainly need all of it for the correct mix and consistency of the IRM material. Just when you think the liquid will not take any more powder, it really does accept and mix with the entire amount of powder. Keep scraping it off of the mixing pad and blending into a homogeneous mix. It will start to thicken up and will be very sticky at this point. We want it to be a doughy consistency without a draw and without any stick. After incorporating all of our powder, you'll have a nice doughy mix. At this point, we can pick it up with our gloved hands and roll it in between our fingers into a ball. The fingers can also be dipped into some extra powder to prevent the ball from sticking if needed. Place the ball back on the mixing pad so it is ready for use. The IRM can then be picked up in increments with the plastic instrument and placed into the tooth prep. Push the material down into the prep, condensing as you go. You can use a 2x2 gauze to wipe the instrument off as you go, and continue adding small increments of your IRM material. You'll have about a 2.5 to 3.5 minute window of working time, so you don't have to race getting the material placed. You will have plenty of time to do so. When the prep is full, work the material up towards the occlusal margins, flaring it out into the grooves and making sure that all the margins are sealed. Before the material is set, you can remove the isolation device and articulate the arches. You'll want to remove any excess material where the prep may be high and check articulation once again. Be sure to clean the metal spatula with the alcohol gauze before the material sets.